Hi, everyone. I'm Dr. Sarah Delatorre. I'm just going to give people a few more minutes to log on, okay? Mm. So, welcome to our webinar. I'm Dr. Sarah Delatorre. I'm a board certified OBGYN. I've been practicing OBGYN for a long time, probably about 20 years or so. I've delivered about 3,000 babies in the Seattle area, which has been such a joy. And then I've taken care of, countless other women for their gynecologic health all the way from puberty up through menopause. I'm very excited to be here today. I have a background in obviously in women's health, but I've done some additional training that I want to let you know about because I'll bring in some of these components of my additional training during our discussion. And so I am a functional medicine doctor. And for those of you who don't know what functional medicine is a type of medicine where we look at the root cause. So if you had acid reflux, for example, I wouldn't just give you a pill for acid reflux. I'd say, well, why do you have acid reflux? Like, what's going on with the bacteria in your gut and your acid levels in your stomach and your stress and what you're eating and all these things, and kind of put the whole picture together. And that's a very wonderful foundation of medicine that I believe in, and I try to adhere to that and practice that. I'm also I'm double board certified in one in OBGYN, and then also for the American Board of Lifestyle Medicine. And this is a recent certification that I've gotten because I believe wholeheartedly that many of our medical problems, our illnesses, come from how we treat our body. So how we're eating, how we're moving, how we're managing stress, what are our relationships like. So basically our whole lifestyle is a big component of that's reflected in our health. Finally, I am a North American Menopause Society certified menopause practitioner. And so what that means is that I've taken additional courses with the North American Menopause Society, which is sort of the expert body for menopause. And so I've taken extra courses to be certified and able to specifically treat women in menopause. So additional training above my OBGYN training. Sonia, I'm very excited to talk with you today. We're really focusing on menopause. I have a list of wonderful questions, some which made me smile and laugh, but I think all of it will be very informative. I want to talk a little bit about sort of the definition of menopause. During my experience as a practitioner, I feel like there's a lot of confusion for women about our reproductive phases in life. So what's premenopausal, what's perimenopausal, what's menopause? And actually, to be honest, our first question reflected that. This woman wrote in and said, I'm not sure if I'm actually in menopause yet. How can I tell? That's a fabulous question. And luckily, the answer to this specific question is quite straightforward. So with menopause, there's a clear definition of menopause. Perimenopause is different, and I'll get to that. But menopause, the true definition, the technical medical definition, is when a woman has gone a full 12 months without a period. So no menstrual cycle for 12 months. You are therefore technically defined as menopausal, and some people say post-menopausal. So you have gone through the menopausal transition. It does get a little confusing, I think, with these words, menopausal transition and perimenopause. But to say I'm menopausal or I'm in menopause or I'm post-menopause means you have not had a period for 12 months. The average age of menopause in the United States is about 52. Some people say 51, but between 51 and 52, the average age of when the average woman has gone through menopause. And again, that means she's not had a period for 1 year. Perimenopause is a little more tricky. Perimenopause is when our body is starting to go through the transition to stop having periods. We are born with all the eggs in our ovaries that we're going to have for our lifetime. So when we are in our mother's uteri, we have all of our eggs, and they slowly attrition over time. We go through puberty, and we've already gotten rid of many of our eggs by the time we go through puberty, which is interesting. And then as we get closer to perimenopause and to menopause, we have less and less eggs. And then finally, we essentially run out of eggs, and there's nothing to ovulate, and therefore nothing to have. Not sure. Sorry, my camera went out for a second. It varies by woman, and some women start going through perimenopause at age 35. They start having fluctuations in their hormones. Some women, nothing until they're 48 or 50. So every woman's different with perimenopausal transition. What is happening in perimenopause that's different than menopause, and I'll explain menopause as well in terms of the hormones, is our hormones are fluctuating in perimenopause. So our brain is trying to tell our ovaries, hey, I need more estrogen. My estrogen levels are down. And which is what is happening is our estrogen levels are waning during the perimenopausal transition. So our pituitary gland in our brain says, okay, oh my gosh, ovaries, get on it. They produce a higher level of a hormone called FSH. And that tells our ovaries, we need more eggs, we need more estrogen. And so what happens is our estrogen levels are going up and they're going down and up and down, and there are a lot more of spikes instead of a nice smooth transition of hormones that we normally have when we're younger during our menstrual cycle. So in perimenopause, that can lead to a lot of mood issues, irritability, more severe PMS, feeling like you're going crazy for no reason, hot flashes, night sweats, vaginal irritation, vaginal dryness off and on. All those are signs and symptoms of having altered levels of estrogen. Once we're truly menopausal, our estrogen levels stay pretty flat. We don't have the eggs that are producing estrogen anymore, and our ovaries are pretty quiet. We are still producing testosterone, which is interesting, and that can lead to some symptoms, which I'll go into. But our ovaries are no longer producing the same levels of estrogen. So that, and over long term, that's what leads to more vaginal dryness, more vaginal irritation, skin dryness. Our skin starts to wrinkle more. The hot flashes tend to wane a little bit in menopause, but some women, I mean, my mother had hot flashes, sadly for me, until she was 65 or 70. So I'll probably do the same thing. But those are all those symptoms start to decrease in terms of the fluctuations and the moodiness and all that. I had someone recently tell me, and I need to look this up, but when our estrogen levels are low, someone was saying that when we're in menopause, we become more like men. So I think historically, all women of a certain age sort of realize you start to care less and less as you get older. You care less what people think. You care less about pleasing people. And someone was making, I think, sort of a joke about it, but our estrogen levels become so stable that we stop caring so much about other people. We're less responsive, and we're more about ourselves in our 50s, which I think is a fabulous thing because most women spend most of their lives caring for other people. But anyway, our estrogen levels are definitely low when we hit menopause, whereas they're fluctuating during perimenopause. Let me see if there's any comments or questions about that, because I feel like it's really important for us as women to understand our cycles and understand our hormones, because it is very confusing. You don't know if you're super irritable because your hormones, or you're just now an irritable person. And I think it can be a difficult time in life to feel steady during perimenopause. So I'm not sure if I'm actually in menopause yet. Back to the question, how can I tell? If you haven't had a period for 12 months, you are menopausal. If you have had a period, let's say your last period was 6 months ago, you're still perimenopausal or in that menopause transition. For women who are having 2 periods a month, sometimes that happens, or very irregular bleeding. One, you need to go see your physician. That can be a common symptom in perimenopause because sometimes we don't ovulate every month when we're in perimenopause. And so our bleeding can become irregular, but you absolutely need to see a physician. But if you're having irregular bleeding, then you're still probably in the perimenopause transition. So hopefully that all makes sense about perimenopause and menopause. Just for the added discussion, premenopause covers it. I think technically it means anything before perimenopause, but pre means before, so it can also mean all the way up until menopause. So premenopause is sort of the broadest category, and then peri is that transition, and then menopause is when you're no longer having periods. And then that lasts now, because we all live for so long, menopause, we're in menopause about a third of our lives now, at least, which is why we really need to take care of ourselves during menopause. And I want to get to some of that about how to take care of ourselves during menopause. So hopefully that all made sense. The next question I think is a I love this woman who wrote this. So she said, at 71, I am no longer indulging in intercourse, but I am still able to orgasm, which is fabulous because a lot of women stop having orgasms as they get older. I have a slightly prolapsed bladder and I use a light pad for occasional leaks. My question is this: is it possible to reverse a slightly prolapsed bladder with regular orgasm? Orgasming seems to involve many pelvic muscles, so I'm wondering if regular indulging would work as a personal workout for the pelvic floor. So I think that's a fascinating question and a funny question too. I think it's a really good thing to think about because having an orgasm, what an orgasm, yeah, I know what you all probably, hopefully you all know what it feels like, but what is happening is the vagina, the muscles in the vagina are contracting. And the reason why evolutionarily and biologically we have orgasms is, so one, we have sex more and then procreate and reproduce the species, but it draws the sperm up into the cervix because our vagina is contracting. And so it's sort of, it's a wave of muscular contractions that goes through the vagina, and it helps to keep the sperm pushed up against the cervix and then hopefully into the cervix and for fertilizing the egg. So to answer the question, excuse me, let me explain what a prolapsed bladder is. So our vaginal canal is, a tight muscular tube before we have babies, and then it's a little bit more relaxed after we have babies. And the bladder rests on top of the vagina, and the rectum rests right underneath the vagina. So with age, with childbirth, with lifting heavy weights, pushing down, constipation, the tight muscular layer that keeps our bladder up where it should be, because tight muscular layer of the vagina starts to relax a little bit. And so not the actual bladder, but the top wall of the vagina can sort of prolapse down into the vaginal canal. It's very common. I don't think I've seen a woman who's had a vaginal delivery in her lifetime not have a little bit of a prolapsed bladder. There's grades of prolapse. Grade 1, very slight. Grade 2, halfway down the vagina. Grade 3, to the end of the vagina where you can see it, and then grade 4, it prolapses through the vagina. A mild grade 1 prolapse bladder is very usually no symptoms, maybe a little bit of leakage, but usually not that often. Most of the time we would not recommend, or all the time to be honest, we would not recommend surgical correction. And it is a matter of tightening those muscles that can help the prolapse, but it's not going to get rid of it. So the question about orgasm, which is involuntary muscle contractions, is I doubt it's going to do a lot for reversing a prolapse. I think the more muscular contraction a woman can have in her vagina, whether it's involuntary through involuntary muscle contractions through orgasm, or it's actually working on those muscles, such as with Kegels, then that will help make a prolapse not worsen. Okay, it can keep it from becoming a grade 2. Other things that can help is if you lift weights, which we all should be doing some strength training as we get older to keep our muscles toned, to keep our balance, all of that. That can when you're lifting heavy weights and you push down because it's heavy, that can also push out the vaginal walls. And so you want to think about doing a Kegel when you're exercising in that way, when you are tightening your muscles as you push down. So if you're doing a squat, you sort of squeeze in. Constipation can make prolapse worse. So making sure that your bowels are flowing freely and, and healthy, easy bowel movement a day, fiber, water, magnesium, those types of things are really important for good bowel health, and then also helping bladder prolapse from not worsening. So my 71-year-old lovely friend who is having orgasms, I say indulge all you want to. I think it's wonderful that you are still able to have sexual pleasure, and it's not going to hurt your prolapse. Maybe it'll help a little bit, but because the contractions are so quick, and not like a sustained, it's hard to say what it would really help, but it certainly won't hurt. And in general, I think when women are sexually active, so if you were using a vibrator or something else to put in your vagina when you're having an orgasm, or if you're still having sex with your partner, then there is some truth to the motto of if you don't use it, you'll lose it. And keeping the vagina pliable by having regular intercourse if able, or using a vibrator or other toy is also helpful to keep the vagina able to accommodate things in it, if that makes sense. Okay, hopefully that answered the question. So the next one is, I'm postmenopausal and I'm taking medication that means I can't use hormone replacement therapy. So what do you recommend for managing these crazy hormone changes without hormone replacement? So my suspicion is if a woman is still having what she's describing as crazy hormone changes, then I think you should probably see your physician, because excess cortisol can lead to hot flashes and night sweats, and also depression and anxiety. So oftentimes women whose hormones are fairly balanced are really stressed out and their cortisol levels high, and then that therefore alters progesterone and estrogen. But it's not an ovarian problem, it's not our egg production problem, it's more of our stress problem. So I'm assuming this woman is not stressed and her cortisol levels are stable, and in general can't use hormones to regulate her, and can't use hormone replacement therapy to regulate her hormones. So there are some what are called phytoestrogens, and what phytoestrogens are essentially plant-based materials, plants which have estrogen capabilities. So they are able to bind to an estrogen receptor and therefore sort of satisfy the need for estrogen. It's a very non-medical way of describing it, but that's essentially what they do. Phytoestrogens are protective against breast cancer. And so if you want to incorporate phytoestrogens, that can be a healthy way to manage the fluctuating levels of estrogen in perimenopause, or truly replacing, or not truly replacing, but helping the levels of estrogen at postmenopausal. So that would be things like black cohosh, soy, having a lot of soy in your diet, as long as it's organic and non-GMO. So if it's GMO soy or altered soy or non-organic soy, then there's a chance that it is actually not healthy for us and can affect our estrogen receptors negatively. Whereas if you're getting organic, non-genetically modified soy products, then it is helpful to use those to protect against breast cancer. Other ways to manage, I would say lifestyle is really important, getting enough sleep, stress management. If it's hot flashes and night sweats, there are antidepressants that can help. Venlafaxine is a good one that can help with nights hot flashes. So there are other non-hormone related therapies that can help with the hormone fluctuations. And there's a lot of good, I think, very good supplements from high-end brands that can be used. So you may want to consider seeing a very reputable naturopath or integrative medicine physician in your community. We have a couple here in Seattle who I trust implicitly, or a functional medicine doctor like myself, who is going to give you more specific guidelines on how to manage hormones without hormone replacement therapy. But it is absolutely doable. I don't want you to feel that there's no hope, that you can't take hormones and you're going to feel terrible, for the next 5 years. That should not be the case. There's lots of resources now for you to be able to use. In terms of making me think about things that to use for vaginal dryness, for a vulva that doesn't feel as good, there's options for that. I think that one of the really good options is estrogen. And most women who are able to take estrogen, I encourage them to use estrogen locally, just in their vagina, and not systemically if they don't need it. But excuse me, local estrogen is very helpful for the vaginal tissues and really helps vaginal dryness. A lot of women don't want to use estrogen at all. A lot of women can't use estrogen. So other options are getting over-the-counter serums, over-the-counter lubricants, and other products that have hyaluronic acid in it, have certain oils, jojoba oil, sea buckthorn oil, that can help soothe the area and make it more comfortable, especially if you're having intercourse. I love VFit for vaginal dryness. It's red light therapy that it looks like what a vibrator would look like, but it is not used. Its function is not really for a vibrator. It has red light therapy and a multitude of red lights, which is red light and infrared light, and you place it in the vagina, and it stimulates collagen production. It stimulates blood flow, and that's a really good non-hormonal method, increasing blood flow to the vagina and therefore increasing lubrication. So there are options for not using hormones, but I think seeing an open-minded physician about other options is really important in your community. So this next person says, I'm constantly experiencing hot flashes. What can I do to help reduce them or alleviate the discomfort when they start? Do they ever go away completely? The next one's also, what do you recommend for reducing night sweats? Is there something I can do before or during bedtime to reduce the chances of getting super sweaty? So again, we've touched on this a little bit so far in terms of the conversation about menopause and symptoms. What night sweats and hot flashes are from, again, assuming cortisol levels are normal, it is the fluctuations in estrogen and progesterone, mainly estrogen, and having lower progesterone that goes along with this transition that our ovaries are going through with producing less estrogen. So if you can take estrogen, estrogen is a very reasonable option. If you use it topically, meaning a gel, a patch, a ring, that is very, very, very safe for most women for a short period of time. We do not like to recommend systemic hormones, meaning a pill, because it goes through your liver. It can increase risk of clotting. It's more likely to cause breast cancer. And that's with progesterone mainly. But anyway, with estrogen, a topical estrogen is a great way to regulate hot flashes and night sweats. And if you are open to hormones, I suggest that you talk to your doctor. If hormones are off the table for you, either for a medical reason or for just worried about getting breast cancer, which there's lots of data that shows estrogen alone does not cause breast cancer, then I would suggest, it's to me, it feels like not great things to offer, but I would be, layered clothing, so you can take layers off. You don't, avoiding hot drinks, especially before bedtime, having a cool bedroom, non-flannel sheets, just being able to regulate your temperature better. Again, those isoflavones, phytoestrogens, those types of things, whether they're in a supplement or in how you're eating, can really help regulate those symptoms of perimenopause. Reducing alcohol is really important. I think most people drank a lot this year. It was such a hard year, and I know a lot of people were relying more on food and alcohol for soothing. I know I was, and I think that alcohol, it absolutely makes night sweats much worse, even for women who are not going through perimenopause. I don't know if any of you have noticed that, but drinking and night sweats and hot flashes kind of go hand in hand. So reducing alcohol, having a plant-based diet, so you're getting a lot of those great antioxidants and and sort of isoflavones within your diet, flaxseed, things like that can really help. Okay. Um, let's see, I think I have a question. So someone's saying, I'll say her initials, JEB wrote in, and she said she's 64 and hasn't had sex for 3 years. She's tried an estrogen cream, the estrogen ring, and nothing has worked. She can't have a lot of estrogen because she had a stroke at 54. So I think JEB, that the VFit would be something to consider if estrogen hasn't worked. I may try to use both of them if I were you. If your doctor's comfortable still with you using a topical estrogen in your vagina, which is overall safe for your history of a stroke. Systemic would not be okay for you, or topical on your, like a full dose on your skin would probably not be something that I would be comfortable giving to you. But estrogen cream, or maybe using more of the cream. The E-string is a pretty low dose, as is Vagifem. So you may want to talk about increasing the dose, and then also consider VFit. Hyaluronic acid can help. There's another medication called DHEA, which has recently been approved. Right now, I can't remember the brand name, but it's the only DHEA suppository that's FDA approved for vaginal dryness. That may be something that you could consider too, and I'd encourage you to talk to your physician. We have another person writing in that says, does melatonin impact night sweats? And this person takes 15 to 25 milligrams per night. So in general, I usually recommend women start with 3 milligrams of melatonin and try not to go above 10, because it can alter other hormones that we have. And so 10 milligrams of melatonin is kind of the max that I recommend. And then working on other avenues of sleep. I would think about getting your melatonin levels and your DHEA levels checked. That's an option with, again, a functional medicine or an integrative medicine physician. And I would look at passion flower, valerian root, magnesium, really working on your sleep hygiene at night in terms of no screens, cool bedroom, resting, kind of, relaxing an hour before bed. Valerian root, passion flower, and there's one more that I use, is also magnesium, is really helpful. Help my sleep. I used to take a Benadryl every night for 2 years, and that's not good for your brain. And altering that has really helped. So I would look at, there's different products that have melatonin plus GABA. GABA is another one that can help people with sleep. So those are some options. Mary has written in and said, can we use topical estrogen on the vulva area? Yes, absolutely. Absolutely. Yeah, there's the vagina has estrogen receptors, estriol receptors, and the vulva does too. And so it can be helpful. Same with the hyaluronic acid stuff. And Joylex, we have a great serum. I love this serum. It's Revitalize Her, and it has jojoba oil, coconut oil. It's hypoallergenic, all natural product. It smells good. It's very soothing to the vulva. So I would suggest that as another option. Okay. This one's a good question. I often feel like my doctor isn't really hearing me when I talk about my menopausal symptoms. What do you recommend for finding a doctor that really listens and wants to help? That's a good question. And I would agree. I think to physicians' credit, I am a physician. I was a very busy physician. I tried to always be present with my patients and take the time. However, this is another topic, but our American medical system is messed up. I mean, doctors do not have enough time with patients. It's because it's, insurance based and all these things. It's just a terrible system. However, many, I would say most physicians are very caring, loving people who really want to help their patients, and then they're in a very difficult system. However, if you do not feel like you're being heard by your physician, how to find another one. So if you can afford it, and it's oftentimes not as expensive as people think, I would try to find a concierge doctor. They're sometimes not as expensive as you think, and they take lots of time with you. They're constantly available to you. And if you have the means, I think that's a very good option to pursue if you have the means. If that's not financially feasible, I would look for physicians that have additional training, so someone like me, like functional or integrative medicine, it means that they're really interested. If it's about women's changes, I would look specifically for a women's health practitioner. I have nothing against primary carers who do pap smears and things like that. They're just not going to be as skilled at managing menopause. I would look for a North American Menopause Society certified practitioner if it's, again, specifically for menopause. Yeah, I think there are many caring doctors out there who will listen, but if you are not being heard, then you do need to move on and find someone else. Word of mouth, Yelp reviews. I had so many patients come to me, which I had no idea I had Yelp reviews, saying, I came to you because your Yelp reviews were so great. And people are quite honest on them. And so I think that's another option to look into providers. Finally, having a conversation when you do see that provider of what was missing for you in the previous provider doctor patient relationship. That always helped me when my patient said, I came to see you, I used to see this person. And I'd say, well, why did you leave? And it helps me know what they need from the doctor patient relationship. And then I can be clear that I can offer that to them. And then we start off on a good foot and a realistic foot. Menopausal weight gain. Yeah. Okay. It's driving this person crazy. I don't blame you. What can I do to get my body back and get rid of this new tummy? Okay. So this is another hormone conversation about menopause. So what I was saying earlier, that our testosterone levels they decrease in menopause for sure, and perimenopause, but they're actually not as much as the estrogen levels decrease. So that's why we get, our random black hairs on our chin. And that's why we develop fat around our bellies like men do. It's so annoying, like our back fat. So what can you do? Well, no one's going to like my answer, but I'm going to give it anyway. So I would suggest that you really pay attention to what you're putting into your body. How we eat is the most important thing. You cannot exercise your way out of a bad diet. You really have to eat healthy. And healthy to me means a mainly plant-based, lots of organic vegetables, healthy proteins, ideally plant-based, just to reduce the risk of cancer, and healthy fats, olive oils, avocados, nuts. Carbs, I would say, are a little bit of the enemy. I don't want to throw all carbs out, but you need the carbs that you need to eat, or that you eat, need to have high fiber, complex carbohydrates, and they need to be balanced at the mealtime. So I don't think people should have a piece of fruit by themselves, by itself. I think they should have a piece of fruit with cheese, a piece of fruit with peanut butter. You need every time you eat a carb or a higher glycemic index food, you need to balance that with a fat or a protein. It just leads to more weight gain if we're just sort of doing a high glucose intake, even if it's a complex carb. Fiber is incredibly important for us to maintain our weight and to keep our bowels healthy and reduce our risk of colon cancer. So yeah, you got to look at your nutrition patterns. Nutritionists now, for quite some time with the Affordable Care Act, nutrition visits are often covered by insurance and apply obviously after your deductible, but seeing a nutritionist, really good nutritionist, and working with them on a meal plan that allows you to not take in excess calories and to be eating balanced, healthy meals. And then exercise, right? So part of the problem too, I've really noticed this lately, is back fat, because I'm a fairly fit person and I'm just getting back fat, probably because I'm almost 50 and it's just on there. So exercise is really important. So we keep muscle tone, and then we're burning fat, but we keep muscle tone. And so there's there's more muscle underneath the flab is really important. And then it increases your metabolic rate. Alcohol and sugar they just make our tummies bigger. So especially if they're carb based, like there's a reason why we call it a beer belly. Carb based alcohol tends to give us more of a gut, but alcohol in general has a lot of sugar in it. And I'm by no means someone who never drinks or anything like that, but I just think women in general, we really need to watch our alcohol intake. There's more and more risk with alcohol, especially with breast cancer. So hopefully that helps. It is frustrating to have our bodies shift. Um, Men's body shifts too, though. I don't want to feel like, oh, men get to do whatever. I mean, they do get to wear gray hair better than we do, I think. But their bodies shift too. It's harder to maintain muscle mass and it's easier to gain weight as we get older, but that doesn't mean it has to happen. It just means we have to work a little harder with what we're putting in our body, and how we're moving our bodies. So, and then the other thing I would say is just like love your little tummy. I mean, if it's one thing if it's like a big tummy and it's not healthy, but if you have a few extra pounds around your tummy, I make sure your posture is good so it doesn't stick out. But then otherwise, like it's your body. Your body's gotten you through a lot in life. I would accept it, as long as you're healthy, I'd accept it and love it. And I don't know, pat it every day. I know it's probably driving you crazy, but I think that as we get older, it's really important to continue to or start loving our bodies as we get older. Otherwise, it's hard to live in them. Okay, so this is another body question. What causes women's arms to sag and get larger as we age? Oh man, I know. What the heck? So how can I stop this? Same thing. I mean, honestly, so I think all of us can attest as we get older, like our skin gets more wrinkly and a little bit more saggy. Like we see it on our faces and all of that. There's lasers and things that you can do aesthetically. But again, I think it's muscle tone. So we're losing muscle tone as we get older. If we're not really active, it's just easier for our muscles to atrophy more quickly, and then our arms look saggier. So if you're not already exercising, I would start exercising. It doesn't have to be this crazy thing where you go to the gym for hours, but making sure that if you get 5 pound weights and you start lifting weights, try to do some push-ups, one, build up to 10 over however long it takes you, but it's muscle. And so that's why our arms are saggy. That's why our bottoms are saggy. Everything starts to fall. We look like we have excess skin, but if you put more muscle mass in there, then you're not going to have that skin will be less saggy. The other thing about muscle mass, it's all important to us, most of us, about how we look and all that, but it's also having strong muscles keeps you more agile as you get older. And as in menopause, as we get into our 50s and 60s, if we're not really active, we start to feel it by the time we get to 65, and it's more difficult to move around and it's harder. My mom is 85 and she has a more difficult time now because she didn't keep up her muscle mass. And I think it's very important for women to do strength training. It does not have to be heavy weights. It just needs to be working those muscles. It's so important for balance and agility and just staying fit and having less saggy arms and less of a belly, right? Okay, so perimenopause has me feel like I'm losing my mind. What do you recommend for mental well-being when our hormones are basically fluctuating so much? So I think another important thing about perimenopause and menopause that we haven't talked about is mental well-being, mental health. So a lot of women become anxious during perimenopause because of the hormone fluctuations, sleep deprivation, body changes, right? So that leads to some anxiety and depression. And there's a lot of evidence that there is mood disorders, increase in mood disorders near perimenopause and menopause. So I think one, awareness and education around it is really important. You're not going crazy. Your hormones are fluctuating a lot. And if you had severe or moderate PMS when you were younger, it can be an extreme version of that. Some women respond very, very well to hormones with that, a little bit of estrogen and a little bit of progesterone to balance things out. Seeing a practitioner who's open to that, who uses bioidentical, even if the FDA approved bioidentical is ideal, so an estrogen patch or a gel, and then a micronized progesterone is the safest way that's FDA approved to use hormone replacement therapy. Antidepressants, anti-anxiety medications, figuring out new ways to manage stress to calm the mental well-being, to get mental well-being by calming our mental state, whether that's through meditation, through a stress management course, seeing a counselor. This is so important for us. And again, most of us spent our 20s running around, getting our careers or getting our families going, and then 30s careers and families more intensely. 40s, we start to, things start to figure out. But if we don't take that time to figure out ourselves and how we function best, then it's easy to get overwhelmed. And then add on to it, hormone fluctuations, it can be quite difficult. So I would encourage you to talk to your practitioner. I would encourage you to think about a counselor. Meditation has worked wonders for me. I never thought I'd be able to sit quietly for that long, but it has really helped. I use the Headspace app. I love it. And it kind of gives you that ability to like breathe through things. There's also, again, supplements and over-the-counter remedies. Theanine, L-theanine is an amino acid that's very safe. It tastes good. It comes in a little chewable that can reduce your sort of stress and your anxiety during the day. It kind of calms you down. That's a great one that I use. Again, magnesium, Calm Forte is another brand. There's lots of sort of over-the-counter supplements that you can work with to see how your body responds best. But all these things together are necessary, whether it's, meditation, making sure you're getting good sleep, making sure you have support, self-care, all those things can very much help our mental well-being, which gets absolutely off kilter during perimenopause and menopause. But if you're ever obviously suicidal ideation, really going off the deep end, kind of that feeling, then I would call a suicide hotline. There's people to talk to, even if you're just thinking about it. But then reaching out to a counselor if you're not quite to that point, but you are really overwhelmed most days, sleeping too much, not sleeping enough, eating habits are off, all that. It's time for a reset for sure. Okay, moving on. Brain fog. Yeah, we haven't talked about that. Brain fog is making life so hard for me. Whether it's at work or at home, I often feel dull and fuzzy lately. What can I do to improve my concentration? Great question. So, yeah, brain fog is real, and it's, again, fluctuating estrogen levels. I'll talk about all the lifestyle stuff again. I would reduce alcohol. I would make sure you're sleeping well. There's lots of brain health supplements, like CoQ10 is a good one. I like Metagenics Wellness Essentials for the brain health, omega-3s. All those things can help our concentration and focus. Again, considering estrogen, if you're a good candidate, might help with that. If you're at the appropriate age and just recently perimenopausal or getting into menopause transition, I think that's a good option. Sleep is so important. Stress management, again, I know I'm harping on these things, but it's important because if our brain is overwhelmed, we're like thinking about all these things, but we're not functioning as fast. It can be overwhelming. So if we can manage our stress, then we do have more capacity for focus and concentration. I would definitely talk to your practitioner about that. That would be someone that I would consider seeing an integrative practitioner, not to knock OBGYNs. I'm a conventional MD doc, but I think you need to find someone who's pretty open-minded about different options to manage these symptoms that you're having. So this person says, I'm in my early 50s and lately I've been so dry down there. What can I do to relieve vaginal discomfort and itchiness? So I think we touched on this a little bit, but just to reiterate, estrogen is great. If you don't want to use estrogen, using a serum such as Revitalize Her, over-the-counter Replens, materials with hyaluronic acid in them are really helpful. Some people use coconut oil to soothe. Just keeping the area as clean and moisturized as possible. And speaking of clean, the next question is, I've been using regular soap to clean my whole body since I was a young woman, but lately my intimate areas feel irritated and dry after a shower. So soap's really drying. So for all aged women, I never recommend soap for our intimate areas. It's too drying. It leads to a lot of irritation of the vulva. So you can use water alone. When I tell patients that, they look at me like I'm crazy, that we're not going to use water alone. People are very conscious about odor and being clean. So I do like Joylux's Refresh Her, the soap product. It's not a soap, but it's a cleanser. I'm sorry, it's the cleanser. The cleanser product is excellent for that because it's pH balanced, it's hypoallergenic. But essentially finding any hypoallergenic, pH balance, no, parabens, no PEGs, no chemicals in it is kind of your best bet for having a safe product for that area, because the vulva and the vagina, but specifically, you're not probably going to wash your vagina, but the vulva is very absorptive. So we have to be careful with parabens and products that have chemicals in them. I would not put them on my intimate area. So dryness is a huge issue. It's really a big issue even for women perimenopause. Even if they're still having periods, a lot of women will say, when we have our period, that's when our estrogen levels are lowest, when we start our cycle. And that's when a lot of women will have irritation, more hot flashes and night sweats as they're going through perimenopause. It's they're part of their cycle. It's a great time to start using a serum or coconut oil or another lubricant. Or again, estrogen, if you want to use it sparingly and you talk to your doctor about it. Those are some options. And then no soap. No soap. Okay, so before I went through menopause, I had an active sex life. I now have no interest at all, despite being happily married. I am dry and have zero interest. What can I do to wake things up and get back to a normal sex life? Okay, this is a fabulous question. We didn't talk about libido. Libido is so important. For most women, libido fluctuates greatly during life. Young woman, high libido often. Then you have babies and your libido goes out the window for a while. And then you kind of get it back, and then you go through menopause. And so when we're cycling, when we're having periods, our body naturally produces hormone fluctuations where we have a higher libido near ovulation. Again, it's all about biology and propagation of the species. So we're more likely to want to have intercourse when we're ovulating, and therefore more likely to get pregnant. When we go through menopause, we've lost our cycle, right? We're not having these beautiful hormonal fluctuations, sometimes not beautiful, but we're not having these hormonal fluctuations that cause us to feel more interested in intercourse. We've sort of flatlined our hormones in a way. So kind of the most medically invasive thing to do is you could talk to your physician about testosterone supplementation. That's tricky though, because there's no FDA approved testosterone supplement for a woman. And the downsides, if you get too much estrogen, is more facial hair, other changes that are not good. Your cholesterol can go up, things like that. A lot of that has been somewhat disproved, but there's no testosterone FDA approved supplement. There are doctors, of course, who are giving women testosterone in very low doses, which absolutely helps libido. So that may be something you want to talk to, again, an integrative physician, a very well qualified, very well educated integrative naturopath or physician. DHEA you can have as a supplement. I would suggest 5 milligrams. Again, I'm not giving you any medical advice. I'm not your doctor. You can't, hold me responsible for this. But I will sometimes ask my patients take DHEA, over-the-counter supplement. Douglas Labs is a good one, 5 milligrams, and that can help. I wouldn't take it daily. I would take it sparingly and just see how your libido responds. So those are some supplements, hormone interventions. Dryness, we've talked about. Dryness absolutely kills a woman's libido, because if sex isn't comfortable, there's no point. Who wants to have sex if it's not comfortable? So dealing with your dryness first, whether it's through estrogen, using red light therapy with VFit, getting a really good lubricant, using dilators. Some women need dilators to start becoming sexually active again because the vagina has shrunk down. It's very uncomfortable. So seeing your physician, getting a dilator. Sometimes there's so much pain that the muscles have started to spasm, seeing a physical therapist for that, but really dealing with the physical issues first will help kickstart the libido and the mental and emotional issues. It sounds like you have a good marriage, and you said a happy marriage. That's so important for wanting to have sex. And then I think the final thing is if you're missing sex, then we need to do all these things. If you're not missing sex, there's a lot of women, a lot of patients that I had that were okay with the transition to not having sex. They sort of missed it theoretically, the way we sort of miss youth, but they weren't too worried about it. That's oftentimes when their husband's also having issues such as erectile dysfunction, or their husband's interest has waned as well. That makes it way easier. But if your partner's interest, husband or wife, If your partner's interest is really high still and yours is not, counseling can help with that. I think absolutely communication about what excites you both, where you are in life, what would help you to get more excited, help you be more interested in intercourse. But there are a few tricks that you can try, but one is to really fix the vaginal dryness first, and then consider maybe DHEA to see if that helps. Just a little background on DHEA, it is a natural hormone we produce in our adrenal glands, and it's a precursor to testosterone. So it turns into testosterone within our adrenal glands. So it naturally goes down as we get older. And so it's reasonable to supplement with DHEA, but at small amounts. Again, I would start with 5 milligrams and not go over 10 milligrams if you wanted to try it. It's over the counter. It's up to you to use it. It's a supplement. It's a trial and error thing that you could see if it worked for you, but you do want to talk about it with your practitioner in case you have, issues that obviously I wouldn't be aware of. That would be a contraindication to you using that. Okay. Um, okay. What is the best lubricant to use now that I'm older and clearly need a lot of it? Okay, so I'd go back to the same idea with lubricants of natural, hypoallergenic, no, no, you know, no parabens, no PEGs, none of these chemicals in there, because you're putting it in a very delicate, very absorptive place in your body. Parabens are related to breast cancer, so we want to keep those chemicals completely out of our body. There are a lot of great, water-based, silicone-based lubricants. I'd say it's kind of trial and error. A lot of my patients would use coconut oil. I really like our serum, the Joylux serum, for a lubricant. It smells good. It feels good. It can be used for both partners, obviously. So that's a very soothing, great lubricant. The photonic gel that comes with the VFit is also a very safe and good lubricant with hyaluronic acid. Again, I've mentioned that before. Hyaluronic acid is great because it's great for our tissues in terms of collagen formation. So hyaluronic acid, I'm a big fan of. But hypoallergenic, and again, no chemical is kind of the baseline that you want to start looking for. And coconut oil easily satisfies that for sure. I've heard a lot about vitamins lately. I'm wondering if a menopausal woman should be taking vitamins and if they really help. Yeah, so vitamins can be a little controversial. I think supplements as a whole, because it's this, probably multi-billion, if not multi-million industry every year. There's a lot out there. There's a lot of information out there, whether it's true or not. It's hard for consumers, I think, to figure things out. So the first thing is, I am a supplement believer, obviously, because I've mentioned a lot about them, but I have certain stipulations for when I recommend supplements. One, the supplements need to be third-party certified. So what that means is they are using another party to certify that what is in the vitamin that they're claiming is in the supplement is actually in the supplement. So they are tested and vetted through a different company who has high standards to see if they actually are carrying what they have in them. That's very, very important. It's NSF is one certification. Pharmacopoeia, I think it's ISP is the other one. Those are really important when you're looking at supplements. I just use certain brands. For my clients, I recommend that they take certain brands. Metagenics, Integrative Therapeutics, there's lots of them out there, but they need to be third-party certified. I think, so the other part of this is our food source not as good as they used to be. We have our food travels from far places if you're not using a local farmer. I don't know why it keeps going off. Anyway, the way food is done these days, it's just not as healthy for us. And so I think a multivitamin is really important. So you are making sure you're getting enough B vitamins. Our B vitamins are really important for our brain function, our metabolism, just our general health, our hair growth, our nails, all that stuff. So a multivitamin with B complex. Most people are low in vitamin D. I live in Seattle. There's my Space Needle. We have no sun here. So I take a lot of vitamin D. Most of my patients, when I test them, are very, very low. So we automatically supplement with vitamin D. As we get older, I was talking earlier about brain health. CoQ10, again, is very important for brain health, for memory, and DHEA, we talked about supplements. Yeah, I do believe in supplements. There's great supplements for menopause. There's a couple of brands that have sort of menopause support supplements, such as it'll have a multivitamin in it, maybe black cohosh, magnesium, things like that, that are good for our brain and our hormone physiology. So I am a supplement person. However, I would say that just like you can't exercise your way out of a bad diet, you can't supplement your way out of a bad diet either. I mean, you can help a little bit, but what we put in our body in terms of food is the most important way to get our vitamins and minerals the best way. So tons of vegetables, a little bit of fruit, healthy fats. We need those omegas. That's another supplement I would think about because it helps with our skin and our vaginal tissues and moisture. But so that's fish, eating fish a couple times a week if you like fish. But what we eat is the most important thing. And then if that's why they're called supplements, is it should supplement a healthy diet. It shouldn't replace a diet. And poor eating is one of our biggest things for having poor health, not feeling good in menopause, having our brains not function well, having our skin not look so great, all of that. So hopefully we covered all the questions. I don't see any others here. So if just make sure we did them all. Yeah, we did. So had such a good time talking to you about menopause. It's an interesting time in life, and the other thing I would say is we don't talk about it enough. I feel that most of my friends had no idea what was going to happen in perimenopause. It's kind of like when you become a mom. If any of you guys are moms, we think we know what's going to happen when we become a mom, or we go through a labor and delivery or pregnancy, but no one really talks about it as much as we should. And I think we're doing our female friends and colleagues and daughters and sisters a disservice by not talking about things more. It's so important. It's a big transition in life. Most women have a lot going on in their lives as we're doing this perimenopause and menopause transition. And the more education we have about it, I think the better women do with it and the better that they feel. So anyway, that's my last bit about the importance of your body and knowing what your body's going through and how to support your body. So I hope you all had a good time and learned something, and looking forward to the next one. All right, take care, everybody. Bye.